Let's talk about the most important vitamin for the heart. It's vitamin E. The vitamin E that I would recommend is called tocotrienols as compared to tocopherols. There's different type of tocotrienols like alpha, beta, delta, and then you have different tocopherols too, which is alpha, beta, delta. But the primary, and I believe the most important part of the vitamin E complex would involve these, okay? So not tocopherols. Yet tocopherols will help you. And so I'm not saying don't consume those, but if you had a choice, this is way better. It works faster and it's deeper and it's a more powerful antioxidant. What food has the most vitamin E? Wheat germ, okay? Where does wheat germ come in? Wheat, as in wheat flour. That makes bread, pasta, cereal, crackers, biscuits, waffles, pancakes, things like that. Of course, vitamin E is already oxidized in these foods. So when you consume these foods, you're not going to get any vitamin E. In fact, it's going to deplete you of vitamin E. So consuming flour products, okay, because you take this grain that has the vitamin E and you grind it up and you expose it to air, you oxidize it, right? And then you heat it, you destroy the vitamin E. Vitamin E is very sensitive to heat and oxygen. So when you consume the flour products, you can create a deficiency of vitamin E and create problems with the heart. Probably the next most damaging thing to the heart is emotional stress. And you've heard of that before where emotional stress can break your heart, right? Especially if it's chronic stress. But as far as the heart goes, if you're deficient in vitamin E, your risk for getting angina goes up. You need vitamin E to help keep the oxygen very high in the heart. And without vitamin E, the heart tends to cramp and you can experience chest pain. And taking vitamin E can greatly reduce chest pain and increase the oxygen carrying capacity in the lungs because vitamin E is an antioxidant, okay? And then you have oxidation in general. Vitamin E counters that, so it reduces damage from oxidation, whether that's from stress or these right here or sugar or whatever. Vitamin E is also good to help regulate blood pressure. If you're low in vitamin E, your blood pressure can go up, affecting the heart. Now, this one is probably the most significant. The coronary artery, which is the main blood supply to the heart. The inside of that artery has a special layer of cells which become inflamed when you're deficient in vitamin E. Vitamin E is normally supposed to be in there to protect that artery from becoming inflamed. So if you're deficient in vitamin E, we don't have any protection. So if you're consuming these foods, for example, or going through stress, you get the oxidation, you get inflammation. Then comes the Band-Aid to put out the fire. Cholesterol as a Band-Aid with some calcium plaquing and fibrous tissue. So you have this plaquing going on and hardening of the arteries. And you can even develop clots. Now, vitamin E typically thins the blood, preventing clots. So it also helps to decrease the risk of stroke. It also can help reduce the risk of atrial fibrillation. So it helps the rhythm of the heart. So you can see, it's very evident that vitamin E has very wide spectrum benefits. And so keep your carbs low, avoid flour products and sugar, try to maintain low stress. And if you need to take some vitamin E, this is the version I would take. I don't have any brand recommendations, but you'll have to just do your own research to pick the brand that makes the most sense to you.